Feminine cycle is viewed as ordinary when menstrual bleeding happens each 21 to 35 days and isn't too much. The typical term of menstrual bleeding is somewhere in range of 2 and 7 days. Irregular period happens when either the recurrence or amount of uterine bleeding varies from that referenced above, or the woman has spotting or bleeding between her menstrual periods. This might be brought about by a variety of factors. The two most basic causes are reproductive abnormalities and ovulation issue. Due to abnormalities in the uterus, an abnormal uterine bleeding occurs. Some of the more common structural causes of abnormal uterine bleeding include non-cancerous lesions of the uterus such as polyps, fibroids, myomas, and adenomyomas, uterine thickening caused by endometrial tissue moving into the outer walls of the uterus. Additional reasons for irregular bleeding incorporate meds that can influence the ordinary level of estrogen and progesterone. Interminable medicinal issues, for example diabetes mellitus or scatters of the liver, kidney, thyroid organ, or adrenal organs, or other restorative issues that can influence the creation and digestion of estrogen and progesterone. Stress and physical problems like change in body weight may disturb the pituitary's level of follicle-stimulating and luteinizing hormones and forestall ovulation. Abnormal uterine bleeding is the occurrence of menstrual bleeding unrelated to structural abnormalities of the uterus or the endometrial lining. Its diagnosis of exclusion made of the structural causes of bleeding and chronic medical disease have been ruled out. Other causes of abnormal bleeding must also be ruled out, including pregnancy complications and medications that influence hormonal action or affect clothing. Dysfunctional bleeding occurs more commonly in the first 5 years after a woman starts menstruating and as she approaches menopause, but it can occur at any time period. The cause of dysfunctional uterine bleeding is anovulation, the absence of ovulation, and the orderly desecration of estrogen and progesterone, and may alert the woman and her physician to the fact that she is no longer ovulating normally. Diagnosis is done with ultrasound to picture pelvic structures. With the help of it, professionals are able to see inside the uterine cavity to look for polyps, fibroids, or scar tissue. The specialist may suggest an endometrial biopsy, an office method to inspect an example of the uterine covering to preclude malignant and non-cancerous variation from the norm. Another way to diagnose is hysteroscopy, where a telescope-like instrument is placed through the cervix into the uterus, which allows the visual inspection of the entire uterine cavity. It might permit the doctor to recognize explicit regions of the endometrium that might be biopsied or expelled with the instruments. The test, which includes blood draw to determine low blood count and hormonal checkup on a blood test to measure pituitary hormones such as prolactin, follicle-stimulating, and thyroid hormones. Disorders of the pituitary and thyroid glands can cause anovulation and menstrual irregularity. The personal treatment prescribed to you by your personal care provider will be customized to the particular reason for irregular bleeding. Basic abnormalities are, for example, fibroids, polyps, or scar tissue frequently can be treated during hysteroscopy. Careful instruments can be embedded through the hysteroscope to locate or address basic abnormalities inside the uterine cavity. Synthetic progestins are used to treat women who have sufficient degrees of estrogen, however who don't ovulate. In case of menorrhagia, heavy bleeding, the administration of an estrogen might be prescribed to briefly stop the bleeding and settle the endometrial covering. Heavy bleeding also can be controlled with medications. Sometimes, heavy bleeding causes anemia in some women, and in such situations, doctor may recommend to take gonadotropin-releasing hormone, which temporarily stops heavy bleeding and will help to correct anemia and heavy uterine bleeding. In some occasions, surgical approach hysteroscope is used to remove of any uterine dysfunctions. Moreover, women who decided not to conceive, endometrial ablation may be recommended. It's done to remove endometrial lining and oral to fix heavy menstrual bleeding. After this procedure, which is performed under general anesthesia, thermal radiofrequency, cryosurgery freezing, or laser beam, periods become light. However, it's not recommended for women who still desire to get pregnant. Patients with PCOS must have their treatment individualized, rely on whether their objective is rebuilding of fertility or standard period. For females with irregular menstrual cycle who are not as of now planning to get pregnant, regular progestin treatment, medroxyprogesterone, acetic acid derivation, 5 to 10 mg orally for 12 to 14 days every month, or oral contraceptives might be prescribed to set up menstrual bleeding and to lessen the danger of hyperplasia and cancerous growth. Abnormal menstrual cycle is a typical issue in women of reproductive age that normally can be adjusted with medical procedure or prescription. Surgical procedure might have the option to address auxiliary reasons for dysfunctional bleeding. In the event that there are no auxiliary causes, medicinal treatment can reestablish regular menstrual cycle. Whatever the reason for irregular uterine bleeding, there are numerous medications accessible today as a rule, and they can resolve the issues. Patients ought to address their PCPs about which restorative or careful choices might be best for them.